So a cervical epidural is a procedure that we use in pain medicine for treating patients who have neck pain, but also patients who have what we call radicular pain, and that's where they have pain, for example, radiating down their arms. This is generally caused by irritation to nerves in the neck, and that's often caused by discs that are either pushing out, protruding, or otherwise irritating the nerve roots. If we have a look at the spine, if we look at the top end of the spine, this is the cervical spine that we're interested in, which is the neck region. It's made up, as you know, of these building blocks, which are the vertebral bodies. In between, we've got the little discs, which are the shock absorbers of the spine. If we look on the back of the spine, we've got these little paired joints, which are called facet joints. When we do a cervical epidural, the patient comes in as a day case. The procedure can be done either with local anaesthesia or with light sedation. The patient is put in the lateral position, that's lying on their side. They're put under an X-ray, and essentially we curl them up into a ball as much as possible and have their head down. And then we identify on the X-ray our landmarks on the X-ray screen, and we clean the area up at the back of the neck, and we put small amount of local anaesthetic into the skin, and then essentially we put something called a TUI needle, which is an epidural needle, which goes through the skin and it just goes progressively in. Each time we carefully place the tip of the TUI needle, we're looking at it on the X-ray screen to make sure we know exactly where it is at all times. Once we get that into the right place, which is the epidural space, you will feel a give with the TUI needle. The TUI needle is connected to a syringe, a low resistance syringe containing salty water, saline. Once you reach the epidural space, essentially there is a give. You will be able to see that also on the X-ray that you're in the right place. To confirm that we're absolutely in the right place, we will then put a very small amount of contrast dye through the TUI needle, and again we will look on the X-ray and we will see that the dye is in the right place in the epidural space. Once we've done that, we will administer either very, very dilute local anaesthetic with cortisone preparation, steroid preparation, and we use mixtures of dexamethasone, triamcinolone, depomedrone, depending on what is required. As with all procedures, there are benefits and risks. The benefits are pain relief, takes about 10 to 14 days to work, sometimes less, sometimes more. Risks, failure, local bleeding, bruising, infection, discomfort, they're all minimal. You may get some numbness, weakness, pins and needles in your arms afterwards for a few hours. That's just local anaesthetic spreading. Up to 1 in 2,000 people can get a nasty headache after the procedure, and it is possible to irritate the nerves, so we use X-ray and contrast dye. Overall, the procedure is a safe procedure and can be very effective.